Hey guys, Dr. Bodle here, and today we're going to be talking about thyroid antibodies and if you need them to be zero to start healing your Hashimoto's. Now, once you find out that you have thyroid antibodies, the first thought for most people is, how can I get rid of them? And this makes sense, right? If the antibodies are representative of some sort of condition, then we want to take as much action as possible to reverse that condition and prevent it from getting worse. Now, sometimes we think the answer to those thyroid antibodies, and oftentimes the thyroid symptoms that we're having, is to be put on thyroid hormone replacement medication. Typically, that's a T4 based medication, something like levothyroxine or Synthroid. Again, when we don't know too much about these things, this would also make a lot of sense. If we have a thyroid problem, then we should probably take thyroid medication. And people can become frustrated when their doctors look at their labs and say, you know what, your TSH is normal, so we're not actually going to do anything. And they feel like they're being made to suffer with some of these symptoms when potentially some sort of action could be taken. And I hear you on all that. And I certainly don't think anybody should be ignored when they're having symptoms, especially when they're as debilitating as they can be with Hashimoto's. However, even though the thyroid medication for the thyroid problem seems like the right solution, there are reasons why, aside from your doctor ignoring some of your experiences, that this actually might not be very helpful to you. We've talked before about how Hashimoto's can actually create two different problems for us. One can be a quantity problem, where our body isn't making enough thyroid hormone, and therefore it's leading to low thyroid symptoms. This can occur because the autoimmune damage, occurring over months or years, can eventually cause enough destruction to the gland where its capacity to produce hormone is greatly impaired. In those cases where someone's hormone levels actually start to become low, then yes, having some sort of medication, and whatever that might be should be something you discuss with your doctor and figure out what the right fit is for you, should definitely be part of your overall strategy. But the other issue, and in my opinion, this tends to be the one that is more problematic for people, is not that we're having a quantity problem, the levels of our T4 and T3 are too low. Instead, it's that we're having a utilization problem. Essentially, our body can't use the hormone that's available to it because we have autoimmune activity and associated inflammation, which is impairing the usage of those hormones. So in the early stages of Hashimoto's, you can have these positive or elevated thyroid antibodies. They can be contributing to this autoimmune activity, and that can lead to low thyroid symptoms. So whether your body doesn't have enough thyroid hormone or it's not using the thyroid hormone that's available, both of these scenarios are going to lead to low thyroid symptoms. The problem is, most doctors out there only care about the amount problem. They're looking to see if your TSH is elevated and if your T4 is low. And if that is the case, then they're probably going to provide you with medication. But if you're having symptoms because of a utilization problem, one, that isn't necessarily going to show up on labs aside from the positive antibodies, and two, most doctors aren't going to know what to do with that. If your T4 and your TSH are already normal, then they can't prescribe you medication, and it probably wouldn't help anyways. The thyroid medication is there to fill a gap or provide a need for your body. But if you're in those early stages of Hashimoto's, then you don't have low levels of T4 yet. So it doesn't make sense to give you more T4 in those scenarios. This is also the same problem that we see with people who have chronic Hashimoto's and have already been placed on medication. Because their condition is so chronic, it has led to that damage to the thyroid gland that we talked about, and their body can't create thyroid hormone like it used to. So like we just said, your doctor's then going to provide you with that medication, and hopefully it'll bring those T4 levels up and it will help to normalize your TSH. That would be a good response. Sometimes that happens, sometimes it doesn't. It depends on the severity of the Hashimoto's. But even when it does normalize things, and again, that's the best outcome we can hope for, many people continue to suffer with symptoms. And in a sense, these chronic scenarios mirror those people who are in the early stages of Hashimoto's. Their thyroid hormone levels are normal. Yes, in this scenario, it requires a combination of what their body is producing and the medication that they're taking. But no matter the source of that thyroid hormone, the body still can't use it like it should. We haven't done anything to manage the autoimmunity, and thyroid hormone replacement medication doesn't really have a lot to do with that. I will note that in some situations, when people have very aggressive Hashimoto's and their T4 levels are low, the very fact that their T4 levels are low can be an additional stressor on the body and another contributing factor to the autoimmunity. So sometimes when people get on medication and those T4 levels normalize, it takes some of that stress away. And in some instances, you can see those antibody levels start to fall. But I want to be clear, this isn't because something like levothyroxine regulates our immune system. It's because hormones, high or low, can be inappropriate for our physiology, and correcting that error can be helpful to supporting normalization. But with all of that said, it really comes down to this. No matter where you're at in your healthcare journey or with your Hashimoto's progression, if you still have symptoms and you're feeling poorly, then we need to do something about it. And whether your doctor is going to provide you medication or not, even in the best possible cases, medication is only a piece of our Hashimoto strategy and will never fix all of your problems alone. So that brings us back to our question about antibodies. It sounds like these are part of one of the main driving factors of our condition. So, do we need to get them down to zero before we can start to heal and see improvements? And there's a few different things that we need to understand and consider when it comes to working on this part of our health. First of all, the level of our antibodies does not always correlate with the severity of our symptoms. That means that if TPO antibodies should normally be under 34, someone who is positive and their TPO antibodies come back as 80, they could be in worse condition than someone whose TPO antibodies are 1,000. And since those levels aren't directly tied to the severity of our symptoms, you could flip those scenarios, and that could also be true. Someone whose antibodies were 1,000 could be worse off than someone whose antibodies are 80. But just because someone's levels are higher doesn't make them worse. The reason why I point this out is because this is the first example of why we don't need to get our antibodies to zero to start improving. Antibodies are only one piece of a much larger autoimmune pathway. And in fact, generally speaking, antibodies themselves aren't the ones that cause direct damage to our thyroid gland and the proteins involved in thyroid hormone production. This means that there's a lot of things going on behind the scenes that we can't necessarily see with our testing, and these physiological changes can have a big impact on the severity of our condition and how we're feeling. But if it was as simple as saying higher antibodies are worse, lower antibodies are better, we would never see these situations where the higher antibody patient has better TSH, better T4, and better management of symptoms. So if someone with a TPO antibody result of 750 can be better off than someone whose TPO antibodies are 80, then that also means someone who has previously tested with high antibodies isn't necessarily going to be better off if their antibodies come back as 10, 12, or 20. It's possible it could be helpful and a sign of overall improvement, but it's not a guarantee. Now, with that said, our next thing to consider is that we do have some general rules. Research has shown that people with TPO antibodies above 500 are at greater risk of developing hypothyroidism than those who have TPO antibodies below 500. So although I just said that someone with higher antibodies isn't necessarily worse off than someone with lower antibodies, and that still holds true, when we look at things from a population or statistical level, it does seem that there's a general trend for people with those higher antibody levels to be more prone to thyroid destruction and a progression of their condition. So from a clinical standpoint, here's what that tells me. If we start making changes, then yes, we would like things to trend downward. And seeing a reduction in thyroid antibodies can be an indicator that the choices you're making are positive and being supportive to your health. However, at the same time, this is also supportive to the idea that we don't necessarily need our antibodies as low as possible. Lower is generally better, but the threshold might be a lot higher than most people think. In my practice, I think it's a good goal to help support people and see if their antibodies can get under 500. Using that as a starting point can give people a reference to work towards, and we know that once we get them under 500, it can have big implications for their clinical progress. From that point, I try to help people track their antibodies under 250 and then ideally under 100. From my experience, these tend to be other important markers, and patients who are able to achieve that tend to be more stable in general. However, when we do look at the research, there isn't a lot of evidence for this. And people whose antibodies were under 100 seem to have similar outcomes in regards to their TSH and T4 levels for people who had antibodies between 100 and 500. So again, this supports our way of thinking that lower is likely better, but there's probably a point where having them be as low as possible isn't providing us any additional benefit. Our next point when it comes to tracking our antibodies is understanding that antibody tracking isn't always linear in nature. Our immune system is often shifting and changing, especially for people who have autoimmunity and their immune system tends to be more sensitive in general. So although you can use antibodies as a proxy marker for how your immune system is doing, and that's why we just talked about looking at that general trend over time, trying to get them at least under 500, there's also things that could come up in your life and change those antibodies in a way that doesn't match your overall progress. So maybe you're going in for your typical blood draw and you've been doing a lot of good things to support your immune system, but during that particular week, maybe you had a lot of stress at work, maybe you weren't sleeping very well, or maybe you caught the flu. These are all things that could be aggravating to your immune system and stimulate more of a response. So even though your thyroid antibodies might have been trending downward nicely, it's possible on this lab that you suddenly see a big spike. So much so that it doesn't fit with your expected pattern or trajectory, and it also gives you a lot of concern that something's going wrong. But as much as a change like that would make you think that something's going wrong, it's very possible that you could still be on the right track. Again, antibodies can be more reflective of something that's going on in the moment. And it doesn't necessarily mean that something is off with your general strategy or your health overall. So remember that antibodies can fluctuate. And if you see a fluctuation like that, make sure you're looking at all of your other thyroid markers, any of the other markers that you're tracking that are related to your thyroid function, and of course, pay attention to how you're feeling. If you're having a flare up of thyroid symptoms and your antibodies are worse and your TSH and T4 are worse, then yes, that sounds like things need to be reevaluated. But if the antibodies are the only thing that's changed, then you may want to stay the course and do your follow-up testing in a few months as per usual. And finally, although it can be a good general rule to try to get your antibodies relatively lower compared to your previous testing, trying to get them into the normal range might be unnecessary, and making the effort to do so could come at the cost of your health. In my mind, if we can help someone to get their TPO antibodies under 200 or even under 100, and they've seen dramatic improvements in how they feel and how they function, plus the rest of their thyroid markers and associated markers have also seen improvements and look very stable, then I think that's a massive win both for the individual, for their labs, and for their health going forward. However, some people still might be concerned if their antibodies aren't in that normal range. In certain cases, I've seen people go to the ends of the earth to try to make that change. They're spending thousands of dollars on testing, and they're implementing every treatment possible, whether it's in the standard medical world, the alternative medical world, or beyond. And I just think a lot of times, all of that is unnecessary. Now, if you're someone who's still symptomatic and feeling poorly, and you're looking for solutions to those problems, then yes, I definitely support you and I encourage you to find different strategies and different practitioners who can provide you with help. I'm not saying that if you have symptoms, you should just give up and everyone should ignore you. What I'm saying is, if you've developed a sensible strategy and it's been effective for you, and you have a good idea of what contributes to your autoimmunity and what doesn't, then if that's helped you to feel better and it's brought your antibodies down into a reasonable range, then doing more just to get those antibodies in the normal range isn't going to give you some added benefit. Even if you are able to get those antibodies into the normal range, and some people do, we know that because of the memory that's associated with autoimmunity, that if you were to start being exposed to some of your personal triggers once again, then likely those antibodies would start to rise. I've said before that just because someone has normal antibodies doesn't mean that their Hashimoto's is gone. And that's why we want to learn about what supports our body the best. That way we can continue to maintain those things even in the face of a condition which most people consider progressive and chronic. But my point is, it's not about whether someone's antibodies are 15 or they're 50. Instead, it's about the health of their immune system, how they're feeling, and understanding that when we do things that don't work well for our health, those antibodies can start to rise. To me, the starting point of those antibodies doesn't matter too much. And it's recognizing the overall trend and change in function that something is wrong and we need to take action. But thinking about things from a big picture standpoint, although having some amount of antibodies can be scary, it doesn't mean that you're necessarily limited in the progress that you can make. And in spite of those antibodies, you can have a very healthy and high functioning life. So, do we need our thyroid antibodies to be zero to start making progress? No. And getting them into the normal range shouldn't be the be all end all for the strategies that you're using or the treatment that you're working on with your doctor. Understand that a general downward trend can be helpful and be reflective of progress, but acute changes in antibodies is possible, and it's not necessarily associated with a flare up, with an increase in symptoms, or an indication that your strategies aren't working. Lastly, remember that your doctor is most likely only going to focus on TSH and T4 levels, and they're not going to be concerned with the presence of antibodies. However, whether your TSH and T4 are normal or not, antibodies and the associated change in immune system function can impair our body's ability to utilize thyroid hormone, and even though our standard labs can look normal, it can still lead to significant symptomatology. But as you may have learned from today's video, antibodies have a lot of nuance to them, and they can be a little bit tricky. So if you have any thoughts or questions, leave me a comment below, and we can continue to discuss things. If you like the video, but you need more help and you're interested in working with me, then you can start that process by sending an email to contact@seattlethyroidhelp.com and inquire about enrolling in my online course. My course is designed for women with Hashimoto's who are exhausted, not getting any help from their doctor, they want to make changes, and they're overwhelmed by trying to do things on their own. Go from feeling tired, frustrated, and discouraged to making confident decisions when it comes to nutrition, supplements, exercise, and lifestyle, all while helping them to better understand the root cause of their Hashimoto's so they can feel strong, energized, and start living their life again. The course is 8 modules long and is extremely comprehensive. Not only does it provide a ton of information, but it also gives you an action plan that you can follow. That way you can achieve the transformation that you want. In addition to the modules, there are also weekly live question and answer sessions, as well as a Facebook group to make sure that all of your questions are answered and you're supported every step of the way. So if that's something that sounds interesting to you, send us an email now. That way you can set up a free consultation with me and we can decide together if the course is a good fit for you. If you'd rather keep researching and working on things on your own, that's okay too. You can check out any of the other videos or playlists here on my YouTube channel. You can follow me on Instagram or Facebook for daily tips, strategies, and information, or you can grab either one of my free downloads, which are listed in the description box below. That's it for this video, and I want you to remember that chronic health conditions like Hashimoto's are challenging, hard, and sometimes feel impossible. But continue to advocate for yourself. Remember that these things can get better, and I'm extremely proud of you for all the positive changes that you are making, even if it doesn't always seem to pan out. But if you did like this video, please remember to give it a thumbs up, subscribe to the channel if you haven't done so, and click on the bell for notifications. New videos come out every Thursday. But my name is Dr. Bodle. I hope you have a great rest of your week, and I will see you in the next one.